Welcome back, everybody. We're joined again by Dr. Georges Benjamin, who's the head of the American Public Health Association, joins us tonight from Washington, D.C. Doctor, let's get back into this COVID discussion. You know, it seems like every week there's a new list of symptoms that get attributed to COVID-19. COVID, though, is still primarily a respiratory infection, correct?
Primarily, the point of entry of the body is the lungs, for sure. It may very well also enter the GI tract, but for sure it goes into the lungs. And no, you have a very robust immune system in your lungs, and you may fight it off. But if it gets in your bloodstream, it can go to other organs. And again, the other thing we know is that while your lungs may be very effective in fighting it off as part of your body's immune functions, that some of the complications we're seeing are due to your body overreacting from an immune perspective.
And this can lead to a situation where your immune system goes into overdrive. I think there's a term for that where the immune system goes haywire.
Cytokine storm is one of the terms, and that is you get this flood of molecular materials that attack lots of stuff, and it attacks your own body while it's attempting to attack the virus. And it really doesn't recognize that the virus is kind of under control. So it's kind of like the cavalry coming in after the first wave of troops have contained the enemy, and then they're coming in not recognizing that they've already contained the enemy, and they destroy everything in sight. And so that's the problem with this. And we're learning a lot more about how this disease invades the body and then triggers the body to actually cause auto-destruction of your own body.
And then there's the question of vaccines. Getting a vaccine to market is not going to be fast, or at least as fast as people want it.
You know, the fastest vaccine that we've never made in this country, I understand, was measles. It took 4 years, and total. To really get it into production and in people's arms. And this vaccine, if we can move it quickly along, it's still going to be a year to 18 months, because not only do you have to get the vaccine right and ensure it's safe and effective for sure, but safe most importantly, then you have to mass produce it. And then once you mass produce it, in a safe manner, okay? Because the polio virus, when it was initially produced and they started scaling it up, they had some manufacturer problems where the virus itself wasn't killed completely. It was a killed virus. It wasn't killed completely, and so you gave it, and some people got polio. So you have to be very careful when you produce this. Once you have an effective therapeutic, you got to produce it safely.
Doctor, this can all happen again with a different virus, right? I mean, have we just been lucky up to now on the pandemic front that we haven't encountered something like this, at least in the last several decades?
Well, we've had several near misses. Let's count them, right? SARS, Zika, Ebola, lots and lots of near misses. SARS, there were a couple super spreaders. One would remember that one of the super spreaders was in an elevator. And some people think that was really what exploded that around the world, because those people then dispersed around the world. We know that MERS, MERS, which is the Middle Eastern Respiratory Syndrome, which is also coronavirus, that comes from camels. And we were very worried that one was going to be the next big one. Well, it turned out it was hard to catch. But it has at least so far, the mortality is like 70–80%. So people die, but in some ways, when you're highly lethal and not very infectious, it dies out quicker. So those are some things. The point is, we've just been lucky.
All right. One last time on the masks, Doctor. What should people know, and what should they be thinking about when it comes to these things?
Remind you that we're also encouraging people who are not infectious to wear the mask, or not perceived to be infectious. And that is for a couple of reasons. Number one, that 25% or so that people are asymptomatic who might be spreading it and don't know they're sick. So we're encouraging everybody to wear the mask for that reason. And as well as, again, it's a barrier. It does reduce, even though you can breathe around the mask, it does reduce the amount of particles that can go into your nose and in your mouth. And that's why we encourage people to wear a mask.
All right, Dr. Georges Benjamin, head of the American Public Health Association, joining us tonight from Washington, D.C. Thank you, sir.
Good to see you, Brent.
And we'll be back after this.